I'm Alpha Phi Alpha Fraternity Surgeon General Dr. Jeffrey Sterling. This vlog is on racial disparities in high blood pressure and how to fight it. I'll briefly explain the differences that exist in hypertension between Blacks and Caucasians, then offer you tips to overcome high blood pressure. This information is largely provided from the U.S. Centers for Disease Control and Prevention. Let's get started. The racial disparity in hypertension and hypertension-related outcomes has been recognized for decades, with African Americans having greater risk than Caucasians. Blood pressure levels have consistently been higher for African Americans with an earlier onset of hypertension. While awareness and treatment levels of high blood pressure have been similar, racial differences in control rates are evident. The higher blood pressure levels for African Americans are associated with higher rates of stroke, end-stage renal disease, and congestive heart failure. The reason for the racial disparities in elevated blood pressure and hypertension-related outcomes risk remains unclear. However, the implications of the disparities of hypertension for prevention and clinical management are substantial, identifying African American men and women with extra hypertension risk and warranting interventions that focus on these differences. In addition, focused research to identify factors attributed to these disparities in risk burden is an essential need to address these evidence gaps. Racial differences are evident at all ages. Blacks are found to develop hypertension at an earlier age than whites. An assessment of US children aged 8 to 17 found systolic blood pressure, which is the top number in your blood pressure measurement, 3 millimeters of mercury and 1.5 millimeters of mercury higher in Black boys and Black girls compared with age-matched white boys and girls. The attributable risk for hypertension and all-cause mortalities is as follows. Black males have a 45.2% attributable risk for all-cause mortality. Black females have a 39.5%, and white males have a 23.8%. This means the presence of high blood pressure leads to death in the percentages I listed in each demographic. In other words, high blood pressure is most deadly in Black men in terms of causing other diseases that lead to death. Let's actually focus on what it is you can do. I'm going to give you 10 action items that are within your reach to accomplish. First, lose extra pounds and watch your waistline. Blood pressure actually increases as your weight increases. Being overweight can cause disrupted breathing while you sleep, which is sleep apnea, and that in turn further raises your blood pressure. Weight loss is one of the most effective lifestyle changes we have for controlling blood pressure. Losing even a small amount of weight if you're overweight or obese can help reduce your blood pressure. In general, you may reduce your blood pressure about 1 millimeter of mercury with each kilogram, which is 2.2 pounds, of weight that you lose. Besides shredding pounds, you generally should keep an eye on your waistline. Carrying too much weight around your waist can place you at risk for higher blood pressure. In general, men are at risk if their waist measurement is greater than 40 inches, and women are at risk if their waist measurement is greater than 35 inches. These numbers vary amongst ethnic groups. Ask your doctor about a healthy waist measurement for you. Number 2, exercise regularly. Regular physical activity, meaning about 30 minutes a day, 5 times a week of moderate intensity exercise, such as walking, can lower your blood pressure by about 5 to 8 millimeters of mercury if you have high blood pressure. It's important to be consistent because if you stop exercising, your blood pressure can rise again. Some examples of aerobic activity you may try to perform in order to lower blood pressure include walking, jogging, cycling, swimming, or dancing. You can also try high-intensity interval training, which involves alternating short bursts of intense activity with subsequent recovery periods of lighter activity. Strength training can also help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. Talk to your doctor about developing an exercise program and determining if you're healthy enough to do so. Number 3, eat a healthy diet. Eating a diet that's rich in whole grains, foods, fruits, vegetables, and low-fat dairy products, and skimps on saturated fat and cholesterol can lower your blood pressure by up to 11 millimeters of mercury if you have high blood pressure. This eating plan is known as the Dietary Approaches to Stop Hypertension, or DASH diet. It isn't easy to change your eating habits. With these tips, you can adapt a healthy diet. Keep a food diary. Write down what you eat, even if just for a week, and this can shed surprising light on your true eating habits. Monitor what you eat, how much, when, and why. Consider boosting your potassium. Potassium can lessen the effects of sodium on your blood pressure. The best source of potassium is foods such as fruits and vegetables rather than supplements. Talk to your doctor about the potassium level that's best for you. Be a smart shopper. Read food labels when you shop and stick to your healthy eating plan when you're dining out too. Reduce salt, also known as sodium, in your diet. Even a small reduction in the sodium in your diet can improve your heart health and reduce blood pressure by about 5 to 6 millimeters of mercury if you have high blood pressure. The effect of sodium intake on your blood pressure varies amongst groups of people. In general, limit sodium to about 2,300 milligrams a day or less. However, a lower sodium intake, such as 1,500 milligrams a day or less, is ideal for most adults. To reduce sodium in your diet, consider these tips. Read food labels. If possible, choose low sodium alternatives for the foods and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. And don't add salt. Just 1 teaspoon of salt, that's level, not even heaping, has 2,300 milligrams of sodium, which is more than your recommended daily intake. Use herbs or spices to add flavor to your food. Ease into it. If you don't feel you can drastically reduce the sodium in your diet suddenly, cut back gradually. Your taste buds and your palate will adjust over time. Limit the amount of alcohol you drink. Alcohol can be both good and bad for your health. By drinking alcohol only in moderation, generally 1 drink a day for women or 2 a day for men, you can potentially lower your blood pressure by about 4 millimeters of mercury. Remember, 1 drink is either 12 ounces of beer, 5 ounces or wine, or 1.5 ounces of 80 proof liquor. And I said either. Remember, that protective effect is lost if you drink too much alcohol. Drinking more than moderate amounts of alcohol can actually raise your blood pressure by several points. It can also reduce the effectiveness of your blood pressure medications. Number 6, stop smoking. Each cigarette you smoke increases your blood pressure for many minutes after you finish. Stopping smoking helps your blood pressure return to normal. Quitting smoking can reduce your risk of heart disease and improve your overall health. People who quit smoking may live longer than people who never quit smoking. Number 7, cut back on caffeine. The role caffeine plays in blood pressure is still debated, but we do know that caffeine can raise blood pressure up to 10 millimeters of mercury in people who rarely consume it. However, people who drink coffee regularly may experience little or no effect on their blood pressure. Although the long-term effects of caffeine on blood pressure aren't clear, it's possible blood pressure may slightly increase. To see if caffeine raises your blood pressure, just check it within 30 minutes of drinking a caffeinated beverage. If your blood pressure increases by 5 to 10 millimeters of mercury, you may be sensitive to the blood pressure raising effects of caffeine. Talk to your doctor about the effects of caffeine on your blood pressure. Number 8, reduce your stress. Chronic stress may contribute to high blood pressure. Admittedly, more research is needed to determine the effects of chronic stress on blood pressure. Occasional stress also can contribute to high blood pressure if you react to stress by eating unhealthy food, drinking alcohol, or smoking. Take some time to think about what causes you to feel stressed, such as work, family, finances, or illness. Once you know what's causing your stress, consider how you can eliminate or reduce stress. If you can't eliminate all of your stressors, you can at least cope with them in a healthier way. Try to change your expectations. For example, plan your day and focus on your priorities. Avoid trying to do too much and learn to say no and not now. Understand there are some things you can't control or change, but you can focus on how you react to them. Try to focus on issues you can control and make plans to solve them. If you're having an issue at work, try talking to your manager. If you're having a conflict with your kids or spouse, take steps to resolve it. Try to avoid stress triggers whenever you can. For example, if rush hour traffic on the way to work causes you stress and road rage, try leaving earlier in the morning or take public transportation. Avoid people who cause you stress if possible. Try to make time to relax and do the things you enjoy. Take time each day to sit quietly and breathe deeply. Make time for enjoyable activities or hobbies in your schedule, such as taking a walk, cooking, or volunteering. Practice gratitude. This by itself can help reduce your stress. Number 9, monitor your blood pressure at home and see your physician regularly. Home monitoring can help you keep tabs on your blood pressure, make certain your lifestyle changes are working, and alert you and your doctor to potential health complications. Blood pressure monitors are available widely and without a prescription. Talk to your doctor about home monitoring before you get started. Regular visits with your doctor are also key to controlling your blood pressure. If your blood pressure is well controlled, check with your doctor about how often you need to check it. Your doctor may suggest checking it daily or less often. If you're making any changes in your medications or other treatments, your doctor may recommend you check your blood pressure starting 2 weeks after treatment changes and 1 week before your next appointment. Number 10, get support. Supportive family and friends can help improve your health. They may encourage you to take care of yourself, drive you to the doctor's office, or embark on an exercise program with you to keep your blood pressure low. If you find you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or morale boost and who can offer practical tips to cope with your condition. Each of these tips is explored in additional Surgeon General Initiative vlogs on Sphinx TV. I'm Alpha File for Surgeon General, Dr. Jeffrey Sterling. Thanks for watching. Be safe, be healthy.